The sleeve gastrectomy, or gastric sleeve, is a permanent procedure. It involves removing part of the stomach, leaving it smaller and narrower. It works in three ways. Firstly, because the stomach is smaller, the amount of food and drink that can be consumed is heavily restricted, reducing portion size and making you feel fuller more quickly. Secondly, the part of the stomach removed is responsible for producing a hormone called ghrelin, which causes hunger. By removing this, appetite is usually suppressed. Finally, we also see extremely powerful changes to hormonal signaling pathways which regulate metabolism. In other words, your metabolism increases, which allows you to burn off more energy stored as fat. Smaller portion sizes, suppressed appetite, and an increased metabolism, in addition to making the necessary lifestyle choices, are a powerful combination which results in significant and sustained weight loss. The sleeve gastrectomy started out as the first stage of a two-stage weight loss procedure called the duodenal switch, or DS. It wasn't until the late 1990s that it became a standalone procedure. Over time, the technique used to perform the sleeve gastrectomy has been modified and refined, resulting in much improved outcomes for patients. Currently, the sleeve gastrectomy is the most popular weight loss procedure undertaken worldwide. The procedure is carried out using a keyhole or laparoscopic approach, usually using 4 or 5 very small incisions positioned around the upper half of the abdominal wall. A general anaesthetic is required so you're fast asleep, and it takes on average between 30 to 60 minutes to complete. The sleeve gastrectomy is created by using a specialized stapling device which simultaneously seals and cuts the stomach, leaving it with a long, narrow shape. This process is guided by placing a long tube into the stomach during the procedure. Finally, the part of the stomach which is permanently removed is extracted through one of the small incisions. The staples used during the procedure are very small and made of titanium. Titanium is strong, non-magnetic, and well tolerated by the body. It is compatible with scanning machines, including MRI, and extremely unlikely to cause reactions. I'm frequently asked about how much stomach is taken away. Is it 70%, 75% or 80%? The short answer is, it depends. Everyone will usually end up with a similar size stomach after the procedure, as the technique for forming the sleeve gastrectomy is standardized. It results in a stomach which is small enough to cause restriction in eating, but not so small that you're unable to take in enough nutrition. So if you're starting out with a much bigger stomach than most, more will need to be taken away compared to someone who has a smaller stomach. Most people can be discharged home the day after surgery, by which time you are able to care for yourself and move freely. Pain and discomfort from the incisions and the carbon dioxide gas used to inflate the abdomen during surgery usually lasts no more than a few days. Physical recovery usually takes between 10 days to 2 weeks, by which time you can return to work. Whilst the amount of weight you can expect to lose will be dependent on many factors, on average, most people undergoing the sleeve gastrectomy lose 3/4 of the extra weight they are carrying by around 12 months after the procedure. People often choose the gastric sleeve because it's a relatively straightforward operation to undertake, it results in significant and sustainable weight loss, and it has fewer short and longer term issues than we sometimes see with the gastric bypass. The sleeve gastrectomy is particularly effective against metabolic and cardiovascular diseases such as diabetes and high blood pressure. In some cases, especially in situations where patients are very heavy, the sleeve may be used as the first stage in a multi-staged approach to weight loss, which may be followed by a gastric bypass. If you have heartburn or acid reflux, or if you have other conditions which affect the food pipe or esophagus, including Barrett's esophagus, the gastric sleeve may not be a good choice. The sleeve gastrectomy is safe, but nevertheless carries with it some very small risks. As with any operation, there are anaesthetic and general surgical risks, such as bleeding, unintentional damage to nearby structures, and deep vein thrombosis and pulmonary embolism, sometimes called clots to the legs and lungs, and infection. Significant measures are put in place to reduce the risks of these from happening. In addition, the sleeve gastrectomy carries a very small risk, usually less than 1%, of leak, where the staple line does not heal properly. If this happens, you will likely need additional treatment in a specialist hospital, which can last for several weeks. In the early days after bariatric surgery, a small number of people struggle with maintaining sufficient nutritional intake, which may require readmission to hospital. Sometimes this can be due to strictures or narrowing of the sleeve, which require additional attention to manage and treat. The risk of any of these complications resulting in death is extremely rare and in the order of less than 1 in 2,000 cases. In the longer term, at least 1 in 10 people can develop new symptoms of heartburn and acid reflux. In some cases, this can be severe, impact on quality of life, and require conversion to a gastric bypass to alleviate. In a minority of cases, reflux can lead to a precancerous condition called Barrett's esophagus. The true risk of this is not really known, but thought to be very small. Significant and rapid weight loss can also result in the development of gallstones in approximately 1 in 5 people, and this may require further surgery to remove the gallbladder if gallstones cause problems. As a procedure which results in significant dietary restriction, it's really important to adhere to the post-operative recommendations with respect to supplements and medication that will support your health. You'll be required to take lifelong daily multivitamins and supplements such as iron and calcium, as well as regular B12 supplementation. Regular blood testing will also be required to make sure that your levels are satisfactory.